The typical type of radiation that is used here is sort of the photons, which is basically X-rays. And they're very high energy X-rays, so a lot higher energy than normal, sort of diagnostic X-rays if you had a chest X-ray or a CT scan. But the problem with these photons that we use for treatment is because they are very powerful and very penetrating, they will enter into a tissue and obviously travel quite a long way, beyond where you necessarily want to treat. And so there are lots of different techniques that we use to try and really confine and contain the treatment, but ultimately there is this sort of radiation, low dose of radiation that is delivered to tissues around. It's unavoidable. So protons is another form of radiation. It's actually a particle rather than X-rays, which are like waves that don't really have any mass. A particle, we can control it in such a way that it, by different techniques, that it can basically, once it enters into the tissues, we can control where it stops, so it doesn't then travel all the way through. One of the recommended circumstances is, say, in children, where you don't want to necessarily treat, a bone, or where a bone is still able to grow next door to where a tumour is. You can perhaps consider using a proton treatment to avoid that. It's not any better most of the time in giving actual proper dose to the tumour. Where it has its advantages, perhaps if there is something around that you really want to spare. So it's not used for every type of tumour or every location of tumour. It's special sort of circumstances. It's not available in Australia at the moment, predominantly in America, in obviously the US, and in some Asian countries. The UK is just about to start a program. They're only just starting to put, I think they've basically decided to put 2 public, at least, units in. They're not ready yet, but they're getting started. And in Australia, the government has decided that we will have a proton facility. At the moment, they have supported Adelaide as being the site. Our big vision is that we should have a number of centres, and that it should all be networked, so that if one centre can't offer something at a particular point in time and someone needs it, then within the network we'll find somewhere for them to be able to go to have it, and we'll all work together.